Hello friends, I am Dr. Swadesh Kumar. I am head of the emergency department, Narayana Superspeciality Hospital, Gurugram. Today on this World Stroke Day, I would like to tell you that we are having a campaign against stroke prevention and its treatment. Especially I would like to mention about stroke in young patients, how to take care of that, how to prevent, and we have a stroke survivor with us today. We'll be talking to him. And before that, I would like to introduce my neurology team, which is there with us present. Dr. Sahil Kohli is there. He is senior consultant neurology, and Dr. Tariq Matin with us. He is interventional neurologist. We would like to tell this campaign about this, how to prevent and how to treat stroke and how to go about it. So I would like to start with Dr. Sahil Kohli. How do you take it forward and tell our viewers about this?
So on this World Stroke Day, we are sharing a live example of a case which has happened in our hospital recently. It is a young stroke, and it will clearly show the importance of the picking up the stroke in the right time, and once the treatment is received, and the stroke management, the current management of stroke that we have, it can completely make a patient absolutely normal.
So I have Dr. Tariq Matin with me. He would like to tell about a brief, what are the other options?
So the stroke treatment, the acute stroke treatment has gone a sea change over past, I would say, less than half a decade, and a lot of things have evolved, and from the thing of complete nihilism in large vessel stroke, big strokes where we were completely helpless. Now from there we are in a position that we can salvage those patients, make those patients disability free, and it's a very interesting case we have got, and we would like our endeavor is to give the message to the community that yes, the stroke is treatable and it can be reversed, the signs can be reversed.
So we have, I think we would like to now hear directly from the mouth of the stroke survivor. I have Mr. Aishwarya with me and his wife Neha. So हम उनके मुंह से सुनना चाहेंगे क्या हुआ था उस दिन जब आपको यहाँ पे आना पड़ा अचानक. बहुत ही अनफॉर्चुनेट था, बट यहाँ पे आपको आना पड़ा, तो आप उसके बारे में क्या बताना चाहेंगे स्टार्टिंग में? हाउ डिड इट स्टार्ट?
मैं उस समय अपने ऑफिस में था. आई वाज सिटिंग ऑन माय सिस्टम, वर्किंग ऑन माय सिस्टम व्हेन दिस हैपेंड. ऑल ऑफ अ सडन मुझे चक्कर आना शुरू हो गए. मेरे राइट साइड ऑफ द ब्रेन में दर्द शुरू हो गया, एंड मुझे फील होना शुरू हो गया लेफ्ट हैंड साइड में मेरा वॉइस में ठीक से बात नहीं कर पा रहा हूँ. मेरा ड्रोल करना शुरू हो गया था. आई वॉज ट्राइंग टू कॉल समबडी, बट मेरी आवाज़ निकल नहीं रही थी बाहर. मैं इतनी देर में कोशिश कर रहा था कि खड़ा हो सकूं. मेरा बॉडी का जो लेफ्ट पार्ट है, मेरा पैर और मेरे हाथ काम करना बंद कर चुके थे एकदम.
लेफ्ट साइड ऑफ द हाफ यू लॉस्ट कंट्रोल ओवर योर लेफ्ट साइड ऑफ द बॉडी, राइट? ओके.
आई वाज कंप्लीटली नम्ब ऑन माय लेफ्ट हैंड साइड ऑफ द बॉडी.
ओके.
मैं कुछ पकड़ने की कोशिश कर रहा था, पकड़ के शायद खड़ा हो सकूं, वो भी नहीं हो पा रहा था. आई डिड नॉट हैव एनी कंट्रोल ओवर माय बॉडी.
ओके. So this is the brief thing. Then we sent to an ambulance, and it happened that he was lucky in the sense that the things were picked up very early, and we sent the ambulance as soon within 15 minutes it reached the spot, and we could manage to bring him in time. And then Dr. Sahil, further.
Yes. So I still remember clearly that at 1 a.m. in the night I got a call that we have a stroke, and it's a young stroke and he's coming in ambulance. And once I reached in the hospital at 1:30 a.m. I had seen Aishwarya. The very first impression that I had that he had complete weakness, left side की हाथ भी नहीं चल रहा था, लेफ्ट साइड के टांग भी नहीं चल रही थी, and his face of the left side was completely paralyzed, and it was getting deviated when he was opening mouth towards the right side. So that gave us the impression that it was a big stroke. So we had to plan everything quickly. We informed the family so that the wife could be brought here, because ये ऐश्वर्या अपने ऑफिस में ये हुआ था, तो इसीलिए वो डायरेक्टली ऑफिस से यहाँ आया था. So his family was informed. He was immediately taken for a CT scan of the brain, which is a standard protocol. CT scan में हमने देखा था mainly basically there was no bleed, एंड देयर वर एरियाज जिसमें ये दिखाई दे रहा था कि राइट एमसीए का एरिया है जो कि एट रिस्क है, इनफैक्ट कुछ एरियाज में दिखाई दे रहा था. तो वंस द ब्लीड वाज रूल्ड आउट, वी स्टार्टेड हिम ऑन ए केमिकल थ्रोम्बोलिसिस जो कि एक्टिलाइज है, वो उनको स्टार्ट कर दिया गया था विद प्रॉपर कंसेंट फ्रॉम द फैमिली. जैसे ही एक्टिलाइज दे दिया गया उसके बाद वी हैड टेकन हिम फॉर ए सीटी एंजियो विच इज़ एक्चुअली टू सी ए लार्ज वेसल ऑब्स्ट्रक्शन. सीटी एंजियो जब हमने किया तो वी वर सरप्राइज टू सी ए लार्ज वेसल ऑक्लूजन. हिज blood vessel of the brain on the right side which is called a MCA, it has a proximally block कि जो जहाँ से वो blood vessel शुरू होती है उसी टाइम में ब्लॉक था. जब भी हमारे पास ऐसा सिनारियो आता है और वो थ्रोम्बोलिसिस के बाद इम्प्रूव नहीं करता तो there are treatment options which are available which are intervention. So our intervention team was alerted. Intervention team had presented, come to the hospital in next 15-20 minutes, and we had discussed with the family. I would like Dr. Tariq to take over from here.
So, as Dr. Sahil have mentioned, we saw a big vessel, the MC, the middle cerebral artery, which is a technical term. A big vessel was blocked in Aishwarya's case, and the drug was given, and now we have to open it, because unless and until we are going to open it, we are not going to save the brain. So there should be some ways to open it. Now with this intervention techniques, we can go inside from the femoral artery, from the artery in the leg, inside the brain, and take that clot out. So the immediate thing after that, yes, we have to prepare the cath lab. We talk to the family. Aishwarya was responding a little bit, but he was not completely comprehending. उसको ये चीज़ें समझ में नहीं आई थी. I talked to the Neha, and I remember one of your friend was with you. She was shaken. It was obvious, very obvious. She was shaken at that time that we have to get in immediately for the procedure. And do you remember, Neha, what conversation we had?
Yes, I remember when I came here first time at Dr. Sahil, he told me that this happened and your husband had a stroke. So we have to take a quick action because we can't waste time. This is a serious situation. He told me we need to give him thinner and we have to perform a surgery. Then you came in picture, you told me that we have to go through this and that. So that was painful. I just came here, I got to know, I never thought it could happen. A simple pain, when person is just feeling headache and numbness or BP issues, and it can convert into this big issue. So that was painful.
So after having consultation with the family, whosoever was available at that hour of time, we took the patient to the cath lab. Our anesthesia team, our ER, the cath lab technical team was completely ready there for the patient. And I also remember now, Aishwarya was completely conscious at that time when we were putting him on the table. We were talking to him, but he got scared during that time, and we tried to make him calm that yes, we are going to do a procedure. Do you remember, Aishwarya, when you were on the table when we were doing the procedure?
I do. थोड़ा बहुत याद है, मुझे पूरा याद नहीं है. तो मुझे ये याद है कि लेफ्ट साइड का जो पार्ट था वो बिल्कुल ख़त्म हो रखा था. आप लोग मुझसे बोल रहे थे मूव करने के लिए, बट आई वाज नॉट एबल टू मूव एनीथिंग. बट मेरा राइट साइड ऑफ द बॉडी वाज शेकिंग अनकंट्रोलेबली. मतलब आई हैड नो कंट्रोल ओवर द राइट साइड ईटर. मतलब मैं बहुत ज़्यादा शेक कर रहा था उस समय. आप मेरे से पूछ रहे थे, कुछ बता रहे थे, मुझे उस समय समझ एग्जैक्टली सब कुछ याद तो नहीं है अभी, बट उस समय बहुत सारी चीज़ें जो चल रही थी मेरे दिमाग में कि क्या हो रहा है, क्यों हो रहा है. And I was very nervous about that at that moment.
And you were scared?
I was very scared.
You were moving a lot in the... So during that time our anesthesia team and all helped us a lot, and we were successful in taking that clot out, and his arteries got perfused, and then Dr. Sahil took over the case from everything. We got a complete recanalization. Dr. Sahil.
Thanks to Dr. Tariq Matin for achieving a complete recanalization of a large vessel stroke. And after that he was in ICU. He was observed because he was given TPA. So he was taken for a CT scan in the next 24 hours. CT scan did not show any evidence of bleed. So once you give a blood thinner and once you open a major blood vessel, there are chances कि reperfusion injury या hemorrhagic transformation हो सकती है. But 24 घंटे तक in his case there was nothing. So once the hemorrhagic transformation and bleed was ruled out, he was started on blood thinners. And during the time he was in hospital, we have seen that he almost had a near complete recovery and he almost walked back to home.
Sorry to interject. Next day morning, I remember when we went into the ICU, I called you and at 11 a.m. and you came in, you saw her. What was your reaction?
I was happy. He was recognizing me. He was in senses, and his hands and limbs. It's moving. Yes.
So it was a
he
great
was happy.
relief.
Yes.
It was
That
a great
was
relief
actually.
for you. I could see from your face the relief on your face was there.
The message that we want to give with this one World Stroke Day is that stroke is not a problem only of older people. Initially, there was a thought that stroke happens only in people more than 60 years of age. But since we are doing practice in neurology, I have seen a 31-year-old having a large vessel stroke. This time Aishwarya, I have seen a 29-year-old having a large vessel stroke, and no major risk factors. The risk factors that you can spot in his face after thorough investigation is only smoking. And that too, how many cigarettes you used to smoke?
Around 10 to 12.
Around 10 to 12. So that was the risk, but his other arteries were all almost, there was no major atherosclerotic changes. So with only a age of 29 years and risk factor of smoking, you can have a major stroke. This is the thing, this is the message that we want to convey. And we also want to convey this message that once you have a stroke, you identify it. So this campaign that we have started this year, it says spot a stroke and save a life from disability, especially a disability of a young person. So once you spot a person is having a stroke, the most important step is you should know that stroke is happening, and once you identify a stroke, you should know what to do. So identification of stroke is very simple. It has been, a 4-letter word has been given, which is called as a FAST. F means sudden onset of facial weakness, A means sudden onset of arm weakness, S means sudden onset of speech problems, and T is time. The time is 4.5 hours, that you should reach the hospital within 4.5 hours, then the treatment of stroke is possible. So first step was identification of the stroke. Once you have identified the stroke, the second step is what to do to identify the stroke. So this can happen to you while you are traveling in a metro, you are at a family function, this can happen to you while watching a movie. So the message is that once you identify a stroke, what is the advice that you want to give to the patient? I would take it other way. I would say what not to do. You should not, see, the heart stroke and the brain stroke are different. If there is a patient is having a heart attack, you can give aspirin to the patient. But in case of a brain stroke, we are not able to give aspirin to the patient because without a CT scan, we do not know whether it is a bleed or it is a clot. So the most valuable advice you can give to a person after spotting a stroke is reach a hospital which has a 24/7 stroke ready, which is 24/7 stroke ready. That means 24/7 stroke ready center, which is a CT scan which is available, and a neurologist and neuro intervention team is ready. Lucky for Aishwarya that he reached to us within 40 minutes of his stroke onset, and we were also prompt, and we could help him in preventing a life of disability.
So I would, Dr. Swadesh would throw some light on our stroke readiness in our hospital. So how well we are prepared. He happens to be our medical superintendent also. So Dr. Swadesh, please.
So friends, I want to tell you, as we say that time is brain. Time is brain means as soon as you reach the hospital, the right place where the center is stroke ready. By center is stroke ready, we means they have got the whole team ready, the treating doctors, the facilities, the CT scan, everything, the medicines which are required. So that is a stroke ready center. Second thing is the timely. As Dr. Sahil has told us that you have to identify it first. It has to be identified, and once you identify that it could be a stroke, even if it is a small suspicion that it could be a stroke, you cannot afford to lose any time. Straight away you have to call the ambulance number, or whatever way you have to reach the hospital at earliest, because you have got only 3 hours to 4.5 hours. So you have to,
Sorry for interruption. Ideally, I want to say that everybody even in our homes, we have parents who are elderly, who are around 50 to 60. So everybody in their household should identify a hospital which is near to their place, which is stroke ready, because Stroke can happen at odd hours. It will happen at 1 a.m. in the morning where you will be fumbling to find somebody for help, somebody to call. So if we have elderly at home, we should always identify a stroke and keep a stroke hospital ready number nearby. So suppose in case that happens, we should reach the hospital as early as possible, because doctors are only able to help if you come to us in time. And coming to hospital in time is the most important thing. That can happen only through awareness, as has happened in this case. Sorry.
So friends, by now I think the message must be clear to you, whatever you want to convey on this World Stroke Day, that the identification and reaching to the spot, and of course a very well equipped team with us, and the way it was identified and it was they reached us in time is the foremost thing which happened in this thing. And I think would you like to say any message to our viewers in this regard?
I would actually. I'm actually thankful to the doctors that I had treating me, because it was I never knew, or I never had thought that I at such an age can get such a big disease. I don't know if I can call this as a disease or not, because 29 years of age, and I understand that smoking is not a good thing for you, but सिर्फ smoke करने की वजह से इतना बड़ा attack आना, I had never thought of anything like this. मैंने इसके पहले मूवीज़ में, टीवी में देखा है ये सब चीज़ें होते हुए, मगर ज़्यादातर ये सब चीज़ें मैंने खाली सिर्फ बड़े लोगों को ही देखा है, एटलीस्ट 40 एंड above की जो लोग होते हैं.
I want to interrupt you here. That this is also needs to be understood, that various studies have shown that almost 15 to 20% of the strokes that are happening, especially in Asian countries, they are happening in people in the most productive age group of their life, that is less than 40 years. So the disability of a stroke is more pronounced when a younger stroke in a family happens. Like a cardiac arrest, if it happens in a family, it affects the whole family. It affects them financially, emotionally. So the idea is that stroke should not be understood as a disease only of elderly. Almost 15% cases of stroke that we see today in our day-to-day practice are people who are less than 40 years. Yes, please.
तो ये जो भी चीज़ हुई है मेरे साथ, उसके लिए I want to thank my colleagues that are there who spotted this and brought me to this hospital as soon as they could, and I want to thank my doctors that were ready with the treatment. They were quickly able to understand what exactly was wrong with me, and they could start the treatment as soon as they can. But coming back to the point, stroke इस एज में बहुत बड़ी चीज़ होती है, स्पेशली फॉर अ पर्सन एज यंग एज 29 ईयर्स ऑफ एज. आप ये नहीं सोच रहे होते हो कि आपको स्ट्रोक जैसी बीमारी हो सकती है, या आपको किसी भी तरह के, यू फील इनविंसिबल दैट यू नो यू कैन नॉट हैव एनी डिजीज, यू कैन नॉट go down so in such a way, but you should always be ready. You should always understand the risks of smoking, of all the other activities that you're doing that are probably not good for you or your family, because it's not just you, it's also about your family. It's also about the people that are dependent on you.
And more so, once you have these symptoms, don't ignore them. Just get them evaluated at a validated center where the facilities are available, because it's always good to just go and check if you have a problem. If that problem is not there, then it is okay, but if that problem is picked up early, it can be treated.
Ma'am, आप कुछ कहना चाहेंगे? I can see smiling face. I think it's
no, actually everyone has said everything. I just want to say that I'm so thankful. I cannot even express in words how thankful I am to the doctors and everyone.
Yeah, but the message should go.
Yes,
yeah. What is the message?
Actually message is that what if every time it's come in my mind, what if he would be alone or in some public place, because what we are doing, हम किसी की help नहीं करते हैं. This is what happening. कोई किसी को पानी चाहिए, कोई अचानक से किसी को स्ट्रोक हो गया या कुछ भी हो गया है, हम लोग इग्नोर करते हैं, अरे यार हमारी प्रॉब्लम थोड़ी ना है. तो प्लीज़ डोंट डू दैट. अगर आपको किसी में भी कोई भी सिम्टम्स दिख रहे हैं कि किसी में कोई प्रॉब्लम हो रही है, प्लीज़ ट्राई टू हेल्प देम. आपका एक स्टेप किसी की लाइफ सेव कर सकता है. एंड हमारे केस में ही वॉज इन ऑफिस, दो इनके कलीग्स है, व्हाट इफ कोई ध्यान नहीं देता, व्हाट इफ वो कहते कि अच्छा इट्स ओके, हॉस्पिटल ले जाने की ज़रूरत नहीं है, कुछ भी मेजर हो सकता था। तो एज एन पर्सन, नॉट कि मेरे हस्बैंड के साथ हुआ है, हम सबको इस चीज़ के बारे में सिर्फ अपनी फैमिली के लिए ही नहीं, अगर हमें कोई भी पर्सन दिख रहा है तो हमें हर किसी की हेल्प करनी चाहिए। एंड एट लास्ट थैंक यू सो मच, थैंक यू सो मच।
Excellent, excellent.
Very well said, Neha. And I think by now everybody must have got the message what we wanted to convey. So identify risk of stroke and take it to the nearest hospital with the facilities. And thank you very much, and thank you everybody.
Spot a stroke, save a life from disability.
Thank you. Thank you.